Quarantine is a tough term to digest, even tough when a government has to call for it, especially during infectious diseases. But what happens when a government can't quarantine everyone? Well, the best solution at this time is social distancing, also known as self-isolation or self-quarantine. And in this episode, we'll explain how important it is. Now, social distancing is defined as an effort to reduce the close contact with people and prevent community transmission of an infectious disease. This voluntary action is called upon by the government in order to flatten the curve. Now, the curve that scientists keep referring to is a projected number of people who can acquire this disease, as depicted in this graph. Now, the problem with an outbreak like this is that a large number of people can acquire this disease within a short period of time. Now, this causes the medical system to operate under a huge amount of stress, thereby causing secondary issues, such as healthcare professionals working overtime and hysteria and panic among the masses. This is exactly what happened in Italy, pushing their healthcare system to the brink. A study estimated that had the containment efforts started a week back in China, the number of infected individuals would have gone down by 66%. And had these efforts started 2 weeks prior, the number of infected individuals would have gone down by 95%. This is exactly why intervention and social distancing is important. Now that we know the importance of intervention and social distancing, let's see how it's worked in the past. The best example of social distancing in the past is a case study of the 1918 influenza pandemic. St. Louis and Philadelphia had two different responses to the outbreak. Philadelphia, on one hand, threw a parade in order to celebrate the peace at the end of World War I, and St. Louis imposed strict social distancing. And guess what the results were? St. Louis had the lowest death rates as compared to the rest of the states, and Philadelphia had thousands of flu cases. This is what flattening the curve is, and what the aim of the current move is as well. Let's talk about what self-quarantining means for an average person. Now, quarantine and isolation are two different terms. Quarantine refers to a general mass who can potentially contract this disease, lockdown, and isolation refers to an infected individual separated from the rest under constant care and supervision. It's important for you to understand that social distancing is a personal responsibility. Now, it may seem easy to perceive this as a vacation, but distancing yourself from people, in general, is really hard. It is important for every individual to cooperate in the society in order for this to work. Let's start from the basics. Get your essential supplies stocked for at least 2 weeks. But this doesn't mean panic buying or overstocking. Follow the health guidelines recommended by the WHO. Also, disinfect the frequently touched surfaces in your house, such as your mobile phones, sinks, refrigerators, etc. The Ministry for Health and Family Welfare issued an advisory for social distancing. Think about it. Distancing yourself from the society will save lives. Literally, participation of every single individual in the society matters. This is what the director of the WHO had to say.
This amazing spirit of human solidarity must become even more infectious than the virus itself.
If you show any symptoms of the disease while in self-quarantine, doctors advise to call them before heading to a hospital directly in order to minimize the risk of contracting the infection from hospitals. That's all we have for in today's show. I'm Neha Nambiar. Don't forget to hit the like and subscribe button. And until next time, always verify news before you share it online. Goodbye!